Hi, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. I'm here with Deb today. Deb's a new patient. Deb has never been to a chiropractor before. We just met and she said she saw some videos online. So I said we want to do a treatment video and here we are doing one. She's in here for low back pain, both sides. At worst, it's an 8 out of 10. Right now it's like a 3 out of a 10. She's an avid runner. How many days a week do you run? Like on ideal week?
Like 5 days a week, 5 miles a day.
Okay, there you go. So quite a bit of running, and she's also mentioning that she's having some tightness and issues with her jaw on both sides. So we haven't done a video for the jaw. We're going to do some jaw work today, and we're going to do some low back work. We already did an exam, so we're just going to do treatment now. You're going to go face down on your stomach, Deb. Head over there. And you said you've done physical therapy before, right, Deb?
Yes.
Okay. So first we're going to do some muscle work on the hamstrings. Yep, I was just going to tell you, you can put your arms down there. That's kind of where it's more comfortable. As we do this muscle work on the hamstrings, let me know if the pressure I'm applying is too much, and I can always go a little bit lighter. And you said you do more road running than trail running?
Yes.
How come?
I guess since I had problems with my ischium, I just decided to not do as much of the trail running because of the trees and the roots.
Oh, okay, like the uneven surfaces.
Right.
And the... Yeah, that's true. The, what do they call the trail around here?
Like Kittatinny State Park?
Yeah, there's the Kittatinny State...
Paul-and-Skill?
Paul-and-Skill, that's what I'm thinking of. Is that, there's still like roots and stuff and weird...
No, actually that running I do. When I think of trail running, I think more of, like running in the woods, trail, like wood running.
Okay, gotcha. Yeah, because that is flat. It's like an old railroad bed, right?
Exactly.
And it's
like softer.
It's perfect on the joints.
Yeah,
you know, you run on the road, you have to deal with the.
No, you're right.
The firmness of the asphalt versus just the regular trail is like a lot easier. So that's just something to think about while you're, feeling better here.
Right.
And you went to a medical doctor? You said Dr. Bradish?
Yes, orthopedic doctor.
Orthopedic doctor who told her that she's having issues with her sacroiliac joint. So the sacroiliac joint is like on the low back, you know where like the back dimples are on people? That's exactly the area where your sacroiliac is. And I don't know if he told you, but your sacroiliac is named that because it's where your sacrum and your ilium meet.
Yes.
That's cool. He was pretty informative, huh?
Absolutely. Yep. He showed me the model of the the replica like you have here in the office.
And I've heard his name before. Where does he practice?
He has 2 offices, one in Andover, right on Sparta Road, and one in Montague, I believe.
Okay. How you doing so far with that muscle work?
Great. Feels great.
Good. And you're on your feet a lot with work too, right?
Yes.
So is this bothering you when you're working?
I guess not really, but maybe just because my mind is so busy with the kids.
Right.
It's been a little bit harder to kind of get up off the carpet lately, but it's all good.
And is that a full day? Like.
Yes.
Yeah.
Yeah.
But summer break's coming up somewhat soon, right?
6.5 weeks.
6.5 weeks, okay. And did you just have spring break too?
Yes. Yeah, just got
that was last week, yeah?
It was. Yeah.
Were they coming back like kind of crazy, wound up, or were they
not really.
a little more relaxed?
Yeah, at that age, they just kind of go with the flow, and when it's time to go back, they're pretty happy about it.
Cool. So have you cracked your knuckles before?
No.
Okay. So you know when we were doing that one test where I leaned you back and it kind of like popped a little bit?
Yes.
We might get a little bit of that in your mid-back. We're going to do your mid-back and your low-back for sure. Neck will decide at the moment if we're going to do that or not. So what you're going to do is you're just going to take a breath in and then you're going to breathe all the way out.
Okay, so I'll take a breath in now.
Yep, breathe in now and then all the way out. Good. And that's it.
Okay.
Pretty easy, right?
Yes.
Let's do that again up here. Breathe in and out.
I'm going to breathe in now.
Yep. Good. How'd you do there?
Pretty good.
We got one more, okay? Breathe in and then breathe out. Good.
Good.
Let's go on your back, face up. So now low back's a little different. You're going to flatten this leg and bend this knee. Good. And you rotate toward me here. And it's the same thing where you just breathe in
Right.
and you're going to breathe out, okay?
So I'll breathe in now.
Yep. Good. How'd you do there?
Good.
Interesting, right?
Yeah.
Bend the right knee and flatten this one.
Bend the right knee flat on this one.
And you're going to, good, and rotate a little here. And breathe in and out. Good. I'm going to get your hips adjusted too,
Okay.
because you're a runner. Relax these legs here. Let this go heavy.
Okay.
Good. And relax this leg here. Good. Okay. Do you want your neck adjusted?
Not today.
Not today. No problem. So I always ask people if they want their neck adjusted if they have like a low back issue. If they have a neck issue, we can adjust it without the cracking or the popping, but you have to do some sort of adjustment on the neck. Have to, because it's gonna work. You know, it
It's
just
all
makes.
kind of related to the.
Yeah, when the low back is just the problem area, I'm not really too concerned about adjusting the neck, but you know, we'll do the work on the jaw and we'll see how you
Alright,
do.
let me see. Yeah, I don't think I'll.
Yeah, after that you
Right.
can kind of decide, because it is possible that your neck might be involved because it's so close to the jaw.
Right. Oh, I see. So that would be pertaining to the jaw, right?
Exactly. So the jaw works pretty easy. You've been dealing with TMJ issues for how long?
7 years.
7 years. Okay. So we're going to work on this now. We're going to do the right side first.
Okay.
Go ahead and open up and close. And relax your jaw. What I want you to do is open all the way, and close. And open, and close. So what I'm doing is I'm massaging the jaw muscles open as she uses them. Open a little more. Good, and close down. Open. Close. Open. Close down. You doing okay? Open. And close. Open again. Open more. Good. Close down. We got a little more open. And close. And just stay relaxed here. Open one more. Good. Close down. Okay. We're going to do the other side. Go ahead and open. Good. And close. And open up. Good. Close down. Open. Is your right side worse than your left?
I'm not sure. I think so, yes.
You can close, open, and close, open again, and close, open, and close, open, close, and open up, open more, good, close down, and we got 2 more, open, and close, 1 more, open up, and close. Okay, now what I want you to do is just try opening and closing without me.
It opens wider.
Okay.
It did.
Is it still tight on one side?
The right side clicks.
The right side clicks.
Right.
Is there tightness though?
Yeah, a little bit, but it's not as tight as it was.
How's the left side?
The left side's better than the right side.
Let's go ahead and open up again. I'm going to do more work on the right.
Okay.
And close. Because I feel like from the beginning the right side was much tighter than the left. Go ahead and open. And close. Open up. Good. Open a little more. And close. Open. A little more. Open. And close. Okay, open up. And close. And 1 more. Open more. And close down. Try that out now and see if that's better than it was.
Right. It's definitely better than it was.
Yeah. Well,
Yeah.
I mean, like a second ago before we went back to the right.
Yeah, I'd say it feels like it's a little bit better on the right as well.
The clicking is one of those things that you're going to kind of have. The reason being is you have a disc between that joint, and the disc is supposed to glide through that joint space, but what's happening is it's gliding and it's getting caught, and then as you're continuing to move the jaw, it snaps and it pops through.
That makes sense.
So it still works, but it's clicking.
Right.
And that's one of the things that I can't really help you with, but I can help with the tightness.
Yeah, okay, great.
So let's go ahead and sit up and see how your low back feels. And try standing. I think you said bending forward was bothering the low back. As standing, walking, running, you obviously can't run in here.
Right.
But, you know, like as you stand here, let me know if you feel any difference in the low back.
Yeah, it feels better than it did when I came in.
Do you still have anything left?
Yeah, I still do. I still feel tightness.
Tightness.
And when I bend forward, it hurts.
It hurts in there.
Yeah, but not as much.
Okay. I want to go for 100% relief. So let's lay on your side. Pick a side. We're going to do both.
So literally, I'm gonna lay on my side.
Yeah. And you're going to bring your left knee up to your chest, and then go back down to where it was, and repeat. Go back up and down, and put your left leg down like you're standing. The other left.
Oh, you mean to put it straight down?
Yep.
Okay.
And then bring it up,
Right.
all the way up to your knee again, and back down to where you were. Good. Keep doing that a couple more. So this is for your piriformis glute med. I did this. I didn't do this before I adjusted you because I wanted to see if this was a muscle thing or a joint thing.
Okay.
Because it's still there, like you feel better, it was a joint thing, but now that the tightness is still there, we know that it's a muscle thing as well. So you're going to bring this leg back and you're going to kick out forward like this. You can keep your knee relatively straight, back and forth like that. How you doing with this pressure?
Fine.
Good. So this is your QL muscle, which stands for quadratus lumborum. It's just a square-shaped muscle near the lumbar spine. And one more. Okay, let's go on the other side. And let's go right knee to chest.
Alright, so, and this leg is just slightly
Doesn't do
bent.
anything
Okay.
really. Yep, right knee up and then down. Good. Pressure's okay?
Yes,
You a little tender in here?
a little bit.
Yeah. This is like almost a pressure point in a way. It's really tender on a lot of people. And one more. Now you're going to swing the right leg like you did the left. And go forward. Yep, and forward, like trying to keep your knee straight,
Oh,
like you're swinging,
okay.
like you're kicking a ball. Yep, come back and forward. Good. Got a few of these. Go further forward. Excellent. Come back. And a few more. And one more. Good. Now let's come up. And we'll try that out. And see if that feels different than it did a second ago.
That feels better after that.
Okay.
Right.
What would you rate the pain or tightness on a 0 to 10 scale there? In the low back?
I mean, like a 1. I mean,
1.
Just, I really don't feel anything.
Okay.
So, yeah.
You
And
gonna
that's
go
a good
running?
thing.
You gonna go running today?
Yeah, maybe I will. Maybe I will, and I'll see.
Yeah, try
And
going
I'll
running.
report back.
Yeah, exactly.
Yeah.
Go running, and if it bothers you, obviously stop.
Right.
Turn around, just go back to the car. But today you might be sore. Put some ice on the area for 20 minutes. Take it off for 40.
Okay.
We have the information in that little pamphlet we
Okay.
gave you. Anywhere that's sore, you can do that. Jaw feels, how much improvement, not a percentage wise?
It feels a pretty big improvement.
Okay,
Yeah,
good,
yeah.
great. Well, thanks for doing
Thank
a
you very
video with me,
much.
Deb.
Yeah, I
I've
appreciate
never
it.
done a video with someone I just met, so thank you for
Okay,
doing that.
yeah.
That was really, really
My
nice of you.
pleasure.
Thanks everyone for watching. I'm your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic.